Morning. It is time for another data update, and I actually have two data updates today. I'd like to show you part one, which will make a case in graphs that I've tried to make in words on social media, and I think the graphs are much better. So let me show you the graphs. The graphs are like when you see in a state like Washington, you see cases are flat. That does not necessarily mean that the epidemic is continuing to expand. You don't really know, but you know there are other reasons why cases might be flat. In Washington State, I believe cases are flat because testing has increased, not because the epidemic itself is increasing. Let me show you what that looks like. You see a lot of examples of this kind of reasoning. Here's raw cases for the New York metro area and the rest of the country. The thing I'd like to show you here is good news, New York metro area is coming down. Bad news, rest of the country is plateauing. It's going straight and even going up by this measure when you take out New York. I would like to also point out these are both on the same y-axis. New York only has 8 to 10 million people in it, New York City. And the rest of the United States has about 300 million people in it. And so the number of cases, you see it's an order of magnitude different in New York City. They've been hit really hard. But I'd like to point out that this is actually, for the rest of the United States, it's a bunch of epidemic curves superimposed on each other. And there are different places with different amounts of testing, and testing itself is changing over time. My argument is, even when you see a plateau, you have to look state by state, epidemic by epidemic. And we have to say, for example, in Washington State, we see a plateau in cases. But I'm going to argue that it is actually getting better, because if you look at the volume of testing, the percentage of positive tests is definitely going down. And this is showing you that graph for the whole country. This is, the bars are the number of cases, the total number of tests that have been done. The blue bars are positive cases. And notice that positive cases are always really low. They're much lower, and we've seen this even in Washington State from the beginning. Notice that the bars are going up over time. We're getting more and more testing done. We are ramping up testing. It's hard to ramp up testing for a big and spread out nation like us. And we did not do a good job at the beginning. We're actually doing a better job of testing now. So we actually are catching more diseases, more positive cases. But we are catching even more negative cases as we test more people. And so this 7-day average is a 7-day average of positivity rate, which means the percentage of tests that are positive. And you see that it's been as high as 20% in the past, but it's gone down to be below 10% for us as an entire nation right now. This is a sign that the epidemic is indeed slowing down and that we are indeed past the peak. Now, when we talk about the peak, I'd like to point out a few things that you've noticed when you're looking at the data. To a first approximation, the rise fits a bell curve, but the drop in cases is not a bell curve. It's much slower because these cases, this disease it hangs around, it hides out. It doesn't follow the same kinetics when it goes down as when it came up. Here's an example of the actual data, and that's what I want to get back to, the actual data from Switzerland about how they have shown that they've been a success. That is not a bell. That is something with a long tail on the right. And so I want to say this is what success looks like, and we should be looking for signs that we are following this curve. The other thing that I'd like to notice about this, even this data, this is really high quality data. Even this is messy. Notice that you have these little dips about every week. Every weekend you have fewer cases reported because doctors take Sabbaths too. Okay, so that's actually a really good thing. It's a sign that we're human and that these data are produced by humans representing human qualities. You've got to look past the things like the day-to-day dips. And again, one of my big arguments, you've got to look at this thing week by week, not day by day. So if you're in the tail part and you double testing, it might look like you're not getting anywhere because it might end up taking what was a drop, and you're seeing more cases now, and bringing that up so that the tail is now flat. And even if you look too close at the Switzerland graph, you know that there are several days in a row, where there's like 4 days in a row where it's flat. And if you just look at those days, you're like, oh no, we're not making any progress. Switzerland is still progress. This is still good, and this is what you expect with the messy data that we're dealing with. So let's put the Washington deaths next to the Switzerland cases. Different kinds of data. And remember that deaths even have their own issues with reporting. One of the things I've noticed about the deaths data is that what's reported on a day probably happened within the past 1 to 6 days, and even possibly more. You'll notice that there's one day that's off the charts because they reported like 70 deaths in that day. It's double what anything else is. It's not that 70 people died that day. If you look at the dates, and it gets really complicated to really tease this out, but they are frequently a week old. I knew this when I was looking at the beginning of the epidemic at the Washington data. Frequently it's been a week since that happened, because a lot of things have to happen for the reporting to come through. The reporting on the day is not necessarily the date that it happened, and it's not correlated. So, therefore, this is messy. And if you look at this looks pretty flat right now when we get to the end of it. But I think it is definitely below peak. You have that well-established peak that was about a month ago. And now we are dropping off that peak. We're in the long tail region. And we're probably about halfway down the slope. You know, it took us only like a couple weeks to climb up the slope, and it's taking us twice as long to climb down the slope. But that's what you expect from a non-bell-shaped curve like this. Again, let's move back from deaths to hospitalizations to see how Washington State is doing. Washington State only started reporting hospitalizations in early April. And so here's all the data for the state as reported. And you notice it used to be up around 600. Now it's down around 300. We have half the patients currently hospitalized for COVID-19 as we did a month ago. I would love for that number to be lower, but I'm happy that it's at least half. We've got to realize that with a disease like this that puts people in the ICU and sticks around for a really long time, this also is progress. If we're worried about the hospitals being overloaded, that does not appear to be a current worry under these current conditions. And so if you look at this here's the case data from March 1 to yesterday, May 11th. Why are Washington cases flat? You can draw a straight line for basically the past couple of weeks. And so the question is, why is that happening? Well, the reason is because the tests have about doubled. Again, the tests are up and down. You see the weekend effect, by the way. You see the tests going down right here after they're going up. And so, but if you average that out, the tests have approximately doubled if you take any long stretch of time within these two regions. And so the tests have gone up. They've definitely gone up on that side. And if you take them and you sort of superimpose, you can see definitely the tests have gone up, but the cases have stayed flat. That's why I'm going to argue that this is indeed some kind of progress. And so the best graph is the one like what I showed you before. It shows percentage positivity. The Washington State percentage positive for COVID-19 tests. This is from March 1 to today. And you see it's all over the place. There's a lot of differences in testing. We've ramped up testing considerably. And in this region, last couple of weeks, we've had the highest number of tests. Let me go back. You see how the tests are the highest that they've been. And yet we have the lowest percentage of positives. That means we're making progress. It's hard to say exactly how this fits on a bell-shaped curve until you look at it for week by week. And then I want to close by looking at the two home counties around Seattle. These are definitely looking, if anything, even better than the state numbers. We're down to about 1/3 or 1/4 of peak for raw cases. Compare it to that, and we'll see how we are doing. So hopefully that will give you a view of how the data shows, even if it looks like we're running to stand still, we're actually making some kind of progress. We've got to continue to be patient, but I want to be a little bit optimistic about how we're doing. All right, that's part 1.